Introduction. As a hospital administrator, one often grapples with the decision between cutting costs and boosting revenue. This decision takes on added complexity when considering the potential impact on different teams within the hospital. A crucial aspect to consider is the potential for bias in decision-making, especially when it involves departmental cost-cutting. Should reductions begin with administrative, clinical team heads, or younger staff? This blog delves into these considerations, evaluating their advantages and drawbacks. Increasing revenue versus cutting costs. A comparative analysis. Increasing revenue. Expanding services. Introducing new or enhancing existing services can attract more patients, thereby increasing revenue streams. Operational efficiency. Streamlining operations to improve patient throughput and satisfaction can also increase revenue. Strategic partnerships. Collaborating with other healthcare entities can open up new avenues for revenue. Cutting costs. Waste reduction. Implementing lean management techniques to minimize waste in supplies and procedures can lead to significant cost savings. Energy efficiency. Investing in energy-efficient infrastructure can yield long-term financial benefits. Technological advancements. Leveraging technology can streamline operations, reducing labor costs. Where to start with cost-cutting in hospitals? In cost-cutting exercises, it's imperative to prioritize patient care quality. The approach should be strategic and considerate, avoiding bias in decision-making. Reducing administrative costs. Pros. Often, a significant portion of hospital expenses and administrative costs can be reduced without directly impacting patient care. Cons. Excessive cuts can impair administrative efficiency and morale, indirectly affecting patient care. Reducing costs in clinical leadership. Pros. This may lead to more efficient management, particularly if redundancies exist. Cons. The loss of experienced leaders can adversely affect patient outcomes and staff morale. Cutting costs among young staff. Pros. Younger staff often have lower salaries, so that the immediate financial impact may be less severe. Cons. Losing young talent can harm the hospital's prospects and learning environment. Addressing managerial bias in cost-cutting. Bias in decision-making. Managers might be inclined to protect their departments, leading to uneven and potentially unfair cost-cutting across different areas. Cross-departmental review. Implementing a cross-departmental review process can help ensure that cost-cutting decisions are equitable and in the hospital's best interests. Transparency and accountability. Ensuring transparency in decision-making and holding managers accountable can mitigate biased decisions, fostering a more unified approach to cost management. Conclusion. Choosing between cutting costs and increasing revenue is not straightforward and requires a balanced, unbiased approach. When considering cost reductions, it's crucial to do so with a view toward sustaining patient care quality and the long-term health of the hospital. Involving various stakeholders and ensuring unbiased, transparent decision-making are key to achieving this balance. In summary, both strategies have their place, but they must be pursued with careful consideration and fairness. As healthcare professionals, our primary commitment is to patient care, and this should always be at the forefront of our financial decisions.